So you have to make a nursing concept map. Where do you even start? Hi, welcome to the UWorld Nursing Channel. My name is Samantha and I am a nurse here at UWorld. Concept maps are a way for nurses and nursing students to plan nursing care around a particular medical diagnosis. They're commonly assigned during nursing school as part of class curriculum or as clinical paperwork from your clinical preceptor. Your map may be based off a real-life client, a case study, or just an overall disease or disorder. Regardless of what style of concept map you use, there are a few key components in every concept map. That is what we're going to talk about today. First up is pathophysiology. What causes this disease? Is it congenital? Is it acquired? Are there specific risk factors like smoking or sedentary lifestyle, for example? Next is manifestations, our signs and symptoms. This can include tachycardia, shortness of breath. It's important to be as specific as possible here. Include all the manifestations that you can find. Then we have our labs to monitor section. This can include things like liver function tests like AST or ALT, or maybe we need to monitor the client's clotting factors. Another important section is treatment and medications. These are the ones indicated for the condition. So what medications are required to treat the underlying condition? What medications are required to manage the symptoms of the condition? Are there other treatments like surgery or maybe radiation required? We're also going to include our nursing interventions, the meat of what we're going to do. This includes nursing care like instilling a high-calorie, nutrient-dense diet to prevent unintended weight loss, or maintain normothermia with warmed blankets and warmed IV fluids. Nursing interventions vary greatly based off the condition at hand. The last section we'll talk about are our nursing diagnoses. Now, these are paramount to completing your map. We use NANDA, which is the organization that makes the nursing diagnoses, to find our applicable diagnoses. A full diagnosis consists of 3 parts: the nursing diagnosis, the related to section, and the as evidenced by section. Now, this is the trickiest part of the concept map. For a more in-depth explanation, make sure to tune into one of our live concept map videos. Lastly, read over your entire map before you submit it. Some instructors are willing to look at it before you submit and let you know any weak areas that may need some additional attention. You can always ask if your instructor or preceptor is willing to do this for you. Lastly, go ahead and leave us any comments or questions below so we know what to make our next video on. Thank you so much for tuning in.